Welcome, I'm Enrico Maraskin. I'm a pediatrician practicing in Morningside in South Africa. This is my passion, little children. I love seeing children in their natural setting, learning, discovering, going to school, playing sport and staying happy. Here we have the vaccine schedule that is produced by the Pediatric Management Group of South Africa, and we can see from the schedule, very busy slide, and by the time the child gets to 12 years of age, we see that there are lots of injections and lots of holes in this poor child's skin. However, on the left-hand column, we have a long list of illnesses which we're going to consider today.
Rotavirus, this is one of the disease processes that we've only just recently started vaccinating against, and it's made a huge difference to the suffering of patients for the fact that they don't have to suffer the illness of rotavirus anymore. Prior to vaccination, an estimated 125 million cases of infantile diarrhea occurred per year, and this included 500,000 deaths per year. Since the introduction of the vaccine, there has been a 70 to 90% reduction in rotavirus gastroenteritis hospitalizations. And as you can imagine, there are huge cost savings to be made, as well as alleviation of suffering that children have to go through when they suffer such a disease.
In our pictures, we have on the top left a pretty picture of a nasty virus that results in the bottom picture where we have a child admitted for dehydration and intravenous rehydration. So this process of admission doesn't come at a small price. The child is often repetitively pricked in order to get the drips and give intravenous fluids and to take bloods, and a hospital stay usually anything can last anything up to 1 to 3 days, sometimes even as long as 7 days, which is not pleasant for any child.
So, having considered the facts pro and con vaccination, what is your decision? I came across this site on the internet. I consent to being forcibly restrained and injected with multiple viral strains, preservatives and heavy metal adjuvants. Said no baby ever. Having looked at all the facts in our talk, you can see that the effects or side effects of the vaccine are very small if one compares it to the devastating effects of the illnesses that we deal with. If we have a look at the right-hand slide, we have a child who's fully immunized and protected against these life-changing illnesses. In my opinion, if I had to choose, I would choose to vaccinate my children fully, with the knowledge that we are placing these children at risk if we don't vaccinate.
So thank you for joining me, Enrico Maraskin, in this discussion. I hope I've shown you the reason for my passion for controlling the disease processes that we vaccinate against, and I hope it'll give you some insight into making your own decision of whether to vaccinate or not vaccinate.